Going to call City of Franklin Board of Health meeting to order April 10th, 2023. At this time, Pat Nissan is excused. Dr. Golden may or may not be here. And somebody else. That's it. And somebody else. That's it.
That is all.
Okay. Everybody else is here. We need approval of the minutes from March 13th.
Approve.
Approved, second?
I'll second.
Okay, any discussion?
I'm leaving, so.
Well, no, do you have to say
All in
that?
favor, aye.
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 Okay. Citizens, no citizens for comment, no unfinished business, so we'll go right into new business and the administrative report and community health improvement plan.
Yes, to give an update on where we're at with the Community Health Improvement Plan process. The next community meeting will be on Thursday, May 11th, and the invitations went out for that today. And so the idea is that it will go to the continuously growing group that's been around the table for the last meetings, and then more people who are recommended to us. So if members identify that there's a gap, and we welcome other names to be brought to the table to help bolster up that group.
You might want to just send one out to Eustace.
Yes, that's a great idea. So I was going to bring it forward today to see if someone would be available or interested in joining. So it will be held at the library here in Franklin from 9 to 11:30. And the idea there will be focusing on the goals of the group and solidifying the mission and vision. The members have been working on that over the past month and a half with one of our contracted trainers. So they have and then solidifying that boots on the ground work that we're aiming to do.
And what day is that again?
That will be Thursday, May 11th from 9 to 11:30. So if anyone is available and interested, shoot me an email and I'll send you the details on it.
Email me.
All right, that
I'll
sounds
put it on my
good.
calendar now.
That would be wonderful. And then Amy and I can update the group at the next meeting. So it will have to be the June one, I believe, how it falls. We'll miss our May meeting, but then we can give you an update in June.
Okay.
The workforce development, this is in regards,
No, go ahead.
progressing on to workforce development. This is in regards to our internal workforce development for the Franklin Health Department. So that was in our former strategic plan under Bill. When Courtney was our health officer, we were obviously full throes in pandemic out, making some edits, getting our refreshed plan in action, but really focusing on some of the internal components of that former plan as of right now. And that was developing our staff internally. And one of those things is happening right now. So the RX Summit is the prescription medication summit down in Georgia that happens. Has taken 2 Volition Franklin members who happen to also be City of Franklin staff. So Gary Wallace, who's a community resource officer, and then Shannon Antoine, which is the assistant chief of EMS at the fire department. So they're all down there to learn how to continue to protect our community locally from substance misuse.
A wild time in Atlanta.
It might be. We'll see all the info they'll come back with
Hopefully we don't see them on the news.
for all great things,
What
hopefully.
happens and
Atlanta stays?
We also have the Wisconsin Public anticipate that a couple of our staff members will go there for best practice learning and then come back and share that with our staff during our regular staff meetings.
Anything on board members? Replacement?
We have no updates in regards to that. Do you have an update?
No interest.
It's in regards to that.
Okay.
Do you have an update?
No interest from my 2 candidates,
Oh,
unfortunately.
okay.
Sorry.
We'll continue to look.
Okay.
Same.
Okay, we'll move into health development general updates and the communicable disease referrals.
I believe this may require a drum roll that we have been so longingly searching for. So that is going to be on the back of the first page. Formerly, there was a ServNet system that health departments would pull reports from. Since then, they have embedded that into the WED system, which is that electronic surveillance. I'm very thrilled to let you know that we can get down to the Franklin level for our different communicable diseases that our health department follows up on. So just a refresher, we were tracking this internally anyways based on our case count, but we didn't have this clean format to pull it forward. So want to have this clean format to pull it forward. So one of our public health staff, Jamie, has been very hard at work to compile this. So you'll see here on the chart in the second column over, we start going through the quarters. And this is, we can change this. So this was just to get something on paper to see how quarterly update, because data less than 5 needs to be suppressed. So if we had monthly updates, we pretty much would always have suppressed data. So we would always have to say less than 5. We could never really say the number. But the thought with this is that hopefully, well, not necessarily hopefully, but as we progress throughout the quarters, we'll have more specific numbers to report on. Then we total them for the year over in 2022 total, and then MKE 23 is showing you Milwaukee County year to date. So,
Does that include the?
city of Milwaukee.
Oh, that's city of Milwaukee?
23 is city
Okay,
of
city of
Milwaukee.
Milwaukee.
Okay.
Yes.
Okay.
But it says Milwaukee County,
Where does it say that?
Up
right?
top.
Oh yeah.
So I think one would be Franklin and one would be Milwaukee County, which obviously would include Franklin.
Yeah.
And is that how we like that then?
That's how it was,
Okay.
yes.
So county year to date is on the far right.
So we would
and
just
then-
compare ourselves to the rest of the county.
Yes.
If there was something big that was statewide, sometimes that would be added extra.
And we
Like,
can do
let's say
a
for
narrative
us,
report on that?
Right. You know, up north, you know, there are high levels of mumps or something. But that wouldn't have to be, you know,
Okay.
grid, that would just be added extra.
And how there's many illnesses that can be as the rows here. And as we get a case, it populates the row onto here. We threw some more on here that we know are more common, so that's why you'll see the zeros. But if there's a certain illness that you don't see on here and think, oh, the health department usually follows up on that, that's because we didn't do the infinite list of possibilities, and we'll just add them as a case breaks on the scene. But then I'll back us back up to the first page. So I also thought it would be nice to share more of those specific service licensed retail establishments, so food establishments. So hotels, motels, pools, restaurants, those are what our sanitarians, environmental health specialists are doing.
Just out of curiosity, what would the total number be? How many are there? 53 out of,
we had
how many are there? 53 out of,
we had, oh, that's a good question. I'll have to get back to you on that. I'm not even going to guess the number. Total establishments.
would you say like a
But we
quarter of them are
probably
done
have about
quarterly?
yeah.
Okay.
Yeah.
So there's about a
And
little over
hopefully
200.
more this year, so that has not been our pandemic, so hopefully we can continue to do quite a bit of inspections. A lot of our time too with environmental health is taken by things that aren't necessarily a widget that could be counted. So we do a pre-inspection, but then we might have multiple visits to help an establishment that's opening up or who has come up. But this would be those on-site annual inspections.
We seem to be getting a council, couple times now, food trucks that want to establish permanent basis kind of things. At different sites, like at Menards, they want to set up a food truck kind of
Firewise,
thing.
yeah.
I mean, and they've got them around, set up
Oh,
a food truck kind of
Firewise,
thing.
yeah.
I mean, and they've got them around town. I mean, I've seen them in different communities where the same food truck is stationed there every day. So those are new food trucks that might be coming to town.
And how that would work then is where their service base is, so where they're going back to every night is from.
Okay.
So if they have a service base here, so if it's a restaurant down the street here in Franklin and that's their service base, then we're going to be their license.
Okay.
Um,
What would you, if there was one there, would you check to see if they had a license?
they would do an inspection. Usually we'll get a call or two that says, oh, this food truck is here. Do they, like, two that says, oh, this food truck is here. Do they, like, do you know
Oh,
that?
okay.
But there's also different intricacies with just popping up shop in the city. You have to be able to be there, and that's a lot of troubleshooting that the health department helps with as well.
Do they need permission? Let's say they open up at Menards, they would need the permission
From
of,
the plan-
what
they're
about,
leasing space, probably,
okay,
you know. But then they have to go through the plan commission, get approval that it's probably not zoned for parking lot, not,
right, because I've seen some on the street.
yeah.
So, I mean, they're not actually associated with the business, they're just on the
Right.
street.
And those would be, you don't know from day to day.
Right.
Where the other one might be a little more permanent.
Yep, and then car seat installations are, well, this actually should not say car seat installations. Yeah, so this is car seat checks, and that's when someone will come in, install their car seats, and then we'll check that to ensure that they followed the instructions properly, talk them through the process. We have 2 people that are certified to do that, so that is
Is Amy our
exciting.
consultant?
This Amy?
Is Amy?
Maybe one day.
I am a car seat technician.
Every morning,
Social
I am a car seat technician.
every morning.
Social service reports, so those are typical reports out from PD or fire. I'm actually probably going to change this to referrals. And that would be someone maybe who is homebound and they want us to check in on their well-being, or maybe a human health hazard, a hoarding experience, and things like that. So those are typical referrals. Animal bite cases, typically dog bites, which usually tick up in the summer. Blood pressure checks, so walk-ins usually for someone in the test kits. We sell those we give those at the front counter. And then sharps containers. We are very busy with sharps on a regular basis, so that is good that people are not just throwing them in the garbage illegally. So happy to continue to offer that service. Quarterly immunization data, we can see what works best for the purpose of this group, but we'll give you a report out on how many clients we saw and then how many immunizations. So we could possibly have 2 kids who had 8 immunizations, or we could have 8 kids. And then the adult clients, total immunizations given.
With the sharps, how accessible is that information that the health department does accept sharps for somebody that's now newly severe brittle diabetic?
I'm
How
glad
would
you
they know
asked
that?
that. We're revamping our website. So we've done an internal deep dive into the content on our website and the usability to try to rework that, but it is currently on our website. In regards to like physician level knowledge, I'm not sure, but if someone were to Google it, Sharps Disposal in Franklin, it would come up.
Okay, okay,
As the site. And when individuals come in here, we ask them to bring it in either a approved Sharps container or one of those hard laundry detergent containers with a screw top lid. And almost everyone that we have come in follows that.
do most physicians advise their patients, these away, you have to dispose of them properly?
Actually, I'm not sure of the physician encounter. I don't know if anyone's had an experience with that
I've never,
No.
I bet it's more pharmacy maybe when they
when
get
they're
it.
picking up
Oh,
their.
yeah.
Yeah, I guess if they ask about it, I've never seen anybody a pharmacist proactively mention that, but I guess I sort of assume everybody knew that, but maybe not.
I don't know if they actually do,
Yeah.
especially senior citizens.
Well,
Also,
I
they
mean,
become
it's-
diabetic, yeah.
Yeah.
the assumption is you use the pills till you're finished with
Sharp.
them.
Syringe.
A syringe.
Oh, the syringes, okay.
Yeah.
I mean, a lot of them may just throw them in the garbage.
I bet.
So maybe some opportunity then for some information gathering if people are knowing.
It's free here, right? They just drop them off, or is
They
there?
do. They
Yeah.
just drop them off.
Can they
Yep.
drop them off at
Pills
pharmacies?
can be dropped.
Yep.
Can they drop them off at
Pills
pharmacies?
can be dropped off.
Some pharmacies take them.
At the police department, so they can walk right into the lobby there.
We don't have any place for pills here?
No, we don't, no, because we don't have the 24-hour surveillance that would be needed for
Oh, I
that.
got it, okay.
But we do sometimes do those pop-up events where a PD would come on site, for instance, at the senior health fair, plug for that, which actually we'll get to in our events. So then on the last page, you'll see that STD case per House of Corrections and then City of Franklin, just so we can continue to paint that picture and give you guys an idea of what's going on with that. And then I thought it would be a nice addition to have our upcoming events in activity. In April, we had National Public Health Week. So our health department was focused on raising awareness about our department, primarily through social media channels, so that, number one, people know that we exist, can utilize our services, and that we can share out education in that regard. Immunization clinics that we have, are meeting tonight. Stepping On series is a series led by one of our public health staff, and that will be starting in the hearing room this week. Bullish and Franklin is switching to a first time daytime meeting. And then Drug Take Back Day, as Amy said. So that's the time to promote the community to get rid of unused and expired medicine that's on their shelves. So please take a look at this. Let me know any feedback. I already have a few edits that we'll make, and bring those to the group next time we meet.
Okay. Well, you covered human service referrals, I believe. Or do you have more on that?
I do not.
Okay, then community health programming.
All right. On National Public Health Week, I talked about that internal focus on website updates and awareness raising. With our older adults, we are really excited. The county had some funding available for local health departments. I'm not sure if we went into this at all at a previous meeting or not, but it was a very sudden and very turnaround. So we found out about it, and it needs to be spent by mid-May. So Franklin Health Department staff got together to look at our community health assessment data and determine where a need might be that fit within the scope of work of this county money. And
Would food pantries be? Would food pantries be in that scope? Or not?
They are, and that is what we're doing. So very good lead-in. So for that, what was approved, which I'll be sending actually out to council this week to let them know once we hopefully get our contract back, is to do increased eating and improving self-efficacy. So helping people learn how to eat healthy, feel comfortable with making a healthy recipe, and then having the tools to do so. So we'll be hosting 5 different series or 5 different sessions across Franklin and bringing in a facilitator to teach on those topics, learning how to read a nutritional label. Also, we're going to be giving healthy meal kits to senior citizens, which would include a couple healthy, we're still ironing out the details, but a couple healthy items, most likely canned, non-perishable food items, that would giving that physical crock pot to them too, so that they have the tools to be able to make the meal, and then the education piece as well.
Is the senior noon lunch program, would that be part of it?
We are most likely on the agenda for the first week in May, so we're solidifying that with John, who's but I think he is going to let us be the speaker again and have about a 30-minute chunk of time that will come in and have someone present on that. Other thoughts were a few different senior living facilities across the city and in here in the health wing, because another exciting thing that we're funding with those dollars is carpeting in here to make this room more user-friendly for senior citizens on these rolly chairs, because we had the relaunch of the senior lunch program start back up and the seniors were utilizing this room, and it's not necessarily the easiest for a variety of reasons, so we're in room to make it easier to access clinic, and then also these chairs. And then 2 other things that we're doing one other thing we're doing is getting 2 sturdy chairs for clinic rooms, so that when individuals are standing up, they have those like support arms that they can lift themselves more easy with. more easy with. And I believe that is all we're using it for. So hopefully we can get that done by May
Do
11th.
we have any wheelchair accessible tables? Yeah, they're kind of like, they're built so that a wheelchair can
Yeah,
have a
I'm
table.
not sure.
I mean, that could just be.
I'm not sure if this is too low. We do have our wheelchair in there, so we can look, but I guess I've never addressed that. That's a good thing to be mindful of.
I know because there's one of the committees has someone who has a mobilized wheelchair, and it's always kind of difficult to maneuver into a table to attend the meeting, so I just was wondering if that's.
Yeah, that's a really good point.
Yeah.
We'll have to look at that. So those are the things in the CBDG funds that we'll be doing. I'll hop on down to the
Sure.
spring walk
Absolutely.
run, which interesting, the approvals for this, and it's gone through the necessary city channels, and then we had found out that at the Rock on that same date, there'll be the Best Buddies Walk, which Best Buddies is a program through the high school that pairs students, and it's a more of a cohort friendship collaborative. We thought, okay, well, let's cancel because we didn't want to duplicate things if we're hosting a run, they're hosting a walk run. But then community feedback persevered, and we found out that that is really more of a high school population, so it will be a very specific subset of. And then our community walk run resource fair is really aimed at a family, like a Franklin family or younger children. It's not necessarily the competitive runner or a high school student. They're obviously welcome, but that's not the main population that turns out. So it is back on for May 20th. We have received confirmation from the rec department that they are willing to do the registration again. We will be hosting a format centered around the 8 dimensions of wellness. So trying to branch out into more creative ways to get. We'll have different community members and businesses that support health in a variety of avenues. So we're going to be very busy trying to pull that one off, but it will be happening hopefully with a very robust turnout on May 20th.
Do you know if it's the same course?
It is the same course. So
And
it's
where's it start and where's it?
it starts at Lion Legend. It's the same course. So
And
it's
where's it start and where's it?
it starts at Lion Legend and it ends at Lion Legend.
Okay.
And it wraps around the neighborhood and then comes back through the park down the trail. And it'll culminate with a resource fair here in the green space. So mark your calendars, everyone. If you'd like to volunteer on May 20th.
Or participate.
Yeah, or participate. Good point. We would love that. And a sub-target population that we're having is senior citizens. So I thought I would take it to the senior lunch group to see what would make them think that it's an event for them. Like what would interest them? Because a lot of the resource tables will have information that would be helpful and interesting for a senior citizen member of our community. And that course is fully accessible. So people can use strollers or wheelchairs or walk, run, what have you. So we're looking to have a nice wide variety of people there. And then the youth mental health first aid training. I had mentioned that 2 of our staff were trained in that, I believe, at a prior meeting. So 2 of our Franklin Health Department staff will be running a pilot with our training for our staff to just get one under their belt, sample it with us, let us give them feedback, and then all of our Franklin Health Department staff will be trained in youth mental health first aid.
What does that all encompass?
That would be when you're interacting. So the training itself is about 8 hours. So we can do a split format of on your own work and then in-person work. And then the goal is by the end of it that when you're communicating with a youth, you would be able to tell signs that they might be having more
Depression or?
or
things
just
like that?
a situation of distress or something that you might need to be intervening about.
Okay.
Would that be redundant for Volition and the social workers in the schools?
The social workers in the Franklin Public Schools, there are, I believe, 2 people who are currently have training to do it, and they do it regularly. So they host community-wide trainings, and this would hopefully only continue to improve the Franklin community. So looking to bring it also then to our community partner network group for whoever may be interested in getting trained.
And what are the ages of the youth? I mean, how low does it go?
That's a good question. I think I'll have a lot more information for you once I take the training.
Okay.
But
Okay.
I think that it'll also be skills that are transferable. So it's more of those identifying factors, and when you're in a conversation with someone, and I don't know that there's necessarily a cutoff age of at this age it won't be helpful anymore. But I'm happy to bring back a summary of how the training goes.
Good.
And then bring it to you guys too. If you're interested in signing up, I can let you know once those dates get set.
Some of the identifiers are age-wise.
Well, yeah, being bullied or
Yeah.
drugs, you know.
Like same symptoms or same indicators that would be any age.
Sure.
And affecting youth.
I would imagine.
I don't
Once you
know.
get into first grade, it starts.
Yeah.
Okay, emergency preparedness planning. COVID's almost over.
Oh, it is.
That's a nice stream. COVID-19 public health emergency, so expected on May 11th. So the state is forming a communications toolkit because there's a lot of different programs wrapped up within that public health emergency that will be affected in a variety of ways. So they're solidifying that toolkit. Our internal plan is to be familiar with the general go-tos in that toolkit and be able to point people in the right direction if they call in. We're not necessarily going to be an expert on how Medicaid benefits are changing, but then we can refer them to someone who might know or point them to a resource.
Do you know if they still have test kits available? I think through the end of April. I heard.
That also is ending. So that is a good lead into what I'm going to say next, is that NACCHO, which is the National Association of City County Officials, is hosting a pilot that they're selecting local health departments to be able to apply for test kits to then distribute to their community. And there's a 200 kit minimum. And we've been doing an internal analysis to determine if we think that they would be well utilized if we had that here. We know that vaccine wasn't necessarily uptook really heavily here because a lot of people are going to other community resources, community sites for that. But now knowing that the landscape around testing is changing and insurance is changing, insurance coverage with testing may or may not be changing, availability might be harder. We think that we're going to write in for that pilot to be able to offer free tests here at the, not that we would administer a test, that they would get an at-home test
Sure.
from us here at the
They
hospital.
come pick one up.
The test kits themselves have expiration dates.
They do, yes.
And are those hard and fast?
It changes. So you have to either check or just be aware of what the state is saying on their current ones. But for the ones that we would write for, they say most likely, they say anticipate to use it within 2 months.
Ooh,
So we would
wow.
have to
And then
disseminate
what
those.
would be the cap on how many per household? Because I know there's 2 per box.
Yeah, and I think they leave that to the local health department to
To
figure it
determine,
out,
okay.
which then we would just have to set our own internal standard for what we would do for currently.
Yeah.
Right.
Yeah,
And that's available.
per month, and I think April's the last month, I believe.
If you know anybody that would like to get them, it's time to
Yeah, definitely.
Yeah.
have them ask. They're readily available. I mean, they come in the mail like within 2
Oh,
days
it's
or
nice,
something.
yeah.
Will there be any lost revenue from the health department once COVID-19 ends, or the federal mandates?
Do you mean any funding sources currently tied to it? One of our primary funding sources right now will go through 2024.
Okay.
So that will not, well, I shouldn't say primary funding sources, but COVID specific funding sources. And now that scope of work has already shifted to being pandemic response to pandemic recovery. So looking at our community and what has happened and where people are now on this other end of COVID-19 versus when it was first starting, is one of our focuses.
Okay.
Then the radiation tabletop, we had multiple staff members from our internal preparedness team attend that. And it's really incident specific. So if a radiological event happened and we had to respond. What would we do? A lot of public health piece in that is taking care of the worried well. So getting messages out to people so that emergency rooms aren't flooded with people thinking they have the symptoms and need to be seen, communicating the need to stay indoors or what precautions to take. That would be our main role, just be able to communicate with different people in the emergency preparedness space. And then our open pod, so that would be a point of dispensing medication so that if we have to stand up a mass clinic or get medication out because of some kind of an emergency event. We currently use the Forest Park Middle School. So we have MOUs signed with Forest Park. We did an on-site walkthrough maybe 2 weeks ago just to look at our map that we currently have in place, touch base with the staff we have now, make sure that we didn't want to change anything, and then continuously revamping that plan as needed. So that is where we are in
Just out of curiosity,
preparedness.
with what happened in Ohio with the train derailing, if something happened in Oak Creek, would Franklin help out?
Well, I can't speak to the emergency response of PD, fire, and entities like that, but I would be pretty confident that we would be pulled into response, especially from a public health standpoint. We regularly work with our regional partners, and that's who we're doing these preparedness tabletops with. So we have the Milwaukee County Healthcare Consortium our partnership that we're already actively having these conversations. And then PD and fire are often sharing services, so I'm sure that they would be in response to that. And Brett, are we ready to move on?
Yeah, any else on health department, general health updates?
I don't have anything specific other than those inspections that I reported out on our handout. Other than the restaurant Brick at the Rock is aiming to open in May. So that's that brick oven, wood fire oven, yeah. So we were on site there a couple weeks ago to do a walkthrough with them and check everything out, and they are slated to open hopefully in May. But a lot going on.
Hot dogs and pizza.
There you go.
Yeah, the dog house, and then hop over to
Yeah.
get some pizza.
Okay, is there anything else? If not, we need a motion to adjourn.
It has been my privilege to serve.
Thank you so much, Michael.
Truly.
Yes.
It's been very enjoyable.
How many years?
Well, Bill was here for at least 2 or 3 years before
Courtney?
Courtney, and I served Bill and Courtney, probably 6.
Yeah, I
6 or
think
7.
maybe 7. I think you
Yeah.
started right when I started.
That's right, yeah. That's right about that time.
Because you were both in Volition together, right?
Yeah.
Yeah.
We were.
Yep.
Oh, the memories. Thank you, Alderman Barber.
But you'll still be around. You'll
Oh,
just-
I'll still be around if you need me for anything, let me know.
Oh,
Do
absolutely.
we have a motion to adjourn?
I
Or a
Motion.
second?
second.
Okay.
I'll second.
Okay, all in favor?